right, we're going to go over the directions you go in your OneNote. So let's get people to read, and I'm going to get volunteers to read, and I'm going to pick on people that don't talk in class. Like, Abby, read number 1, please. Yeah, read the question. Okay, proximal to the fingers, distal to the wrist, on which surface? Anterior or posterior? It says ventral or dorsal. Ventral. So would this be ventral, right? Because it's like this, ventral. You need to learn anatomical position. So everyone put your hands off to the side and put your palms forward. Correct anatomical position is always palms forward. And if you notice when you do that, which way are your thumbs facing? Up. So thumbs up, you're doing it correctly if your thumbs are up. Good job. Now, I want you to put it the wrong way really quick. Let's talk about a couple things. Notice when you put it the wrong way, thumbs down. Boo, you got it wrong. Thumbs down. Also, notice it switches not just your hand. Look at when you switch. It switches the bones in your forearm. It switches your elbow. It switches the muscles all the way up your arm. So if you're in wrong anatomical position, it's not just going to mess up your hand, muscles, and bones. It'll mess up all the way up your arm. So put your hand back in anatomical position. Let's see. Thumbs up. Everyone say, gig 'em. Gig 'em. Congratulations. You're all Aggies. Ha ha. The best cult in the world. All right. So going back to number 1, if it's on the anterior surface or ventral surface, what would that be? The palm. So the answer is palm of the hand for number 1. Good. Number 2, Diego. On the anterior, so would that be front or back? Front. So superior to the nose, posterior to the top of the head, on the anterior side. So what would that be? Forehead. You could also say eyebrows. You could also say eyes. I said forehead. You know it's called a forehead because you put 4 fingers on it. I made you touch your face. Ha ha. Oh, you're a 5 head then. Are you a 3 head? You might be a 2 head. Yes.
So for the first one, I said.
Yeah, so it would be toward the pinky side. Yeah, good. Even more specific. I like it. The correct answer, just to get credit, would have been palm of the hand. So yeah. Bonus point, that doesn't matter. Let's see, next one. Aman, you knew I was going to pick on you. Read number 3. Okay, proximal to the knee, so that means closer to the trunk. Distal from the hip on the which surface? Lateral, so would that be the inside or the outside of the leg? Lateral means to the side, so that would be away from the midline, so that would be the outside of the thigh. So the answer is outside of the thigh. You be careful with lateral and medial. Let's see, who do I want to call on now? McKenna. So what would the most distal point of the thigh be, McKenna? The what? The distal point of the thigh would be the knee. That would be the most distal point. But that's very vague still. Are we talking about the front of the knee, the back of the knee, the outside, the inside? The inside of the knee, how did you know it was the inside of the knee? It doesn't just say medial. In anterior-medial. So if you want to be really specific, you could say anterior-medial. medial, so it's halfway between the front and the side. You know, kind of like north, northwest or south, southwest. But the correct answer is inside of the knee. Inside of the knee. Good, McKenna, you survived me calling on you. Yay, see, you'll survive, just like Frank. Frank, read the next one. Okay, so most proximal point of the arm would be the shoulder, right? On the anterolateral, so would that be the front or the back? Front, and lateral would be side, so what would that be, Frank? Yeah, so you just the shoulder, the tip of your shoulder. You could say what region if you wanted to be really extra. The deltoid, yeah, the deltoid. Nice, good. And Frank, congratulations on surviving me calling on you. Brayden, you feel good enough for me to call on you? Perfect, go. Ooh, we're talking about planes now. So superior to the shoulder, inferior to the head. So what's between the shoulder and the head? Your neck. Where's the coronal plane? Okay, let's think it through. Show me sagittal. Sagittal cuts this way. This is a sagittal cut. This is a sagittal cut. Sagittal. Any cut going this way is a sagittal cut. Show me a transverse cut. Good, you should all cut your head off. Transverse your head off. Transverse, this is a transverse. This is a transverse cut. Any cut anywhere along here is a transverse cut. Now show me a coronal. Corona, you wear your mask in the front. So this is a coronal cut. This is a coronal cut. This is a coronal cut. Any cut going this way. So if it's on your neck on the coronal plane, where would it be? Would it be here, here, here? The coronal plane cuts it on this way, doesn't it? So where would it be? No, not that front. The coronal plane is here. So it'd be on the side of the neck. The sagittal plane cuts it in the front. So if it was the sagittal plane, it would be in the front. It's on the side of the neck. So what? So the ears would be on the coronal plane too, would cut through your ears. But you could also cut through the ears doing a sagittal cut this way. You could also cut them transversely. Yeah, you could cut the ears 3 ways. Don't do that. Don't pull a Van Gogh. That's my second Van Gogh reference of 4th period. I should keep that going. Mallory, since you keep looking at me, why don't you read the next one? The most proximal point of the thumb, would that be the tip or the base? You got it, the base of the thumb. Good. Thumbs up. All right. And then let's see. You know, I pick on Mallory, but I don't pick on April enough. You think I should pick on April? Say no. April said, say no. Hard, compact surface deep to the skin. So would that mean closer inside or farther outside? Like deeper inside. So what would that be? What's hard inside your body? Like deep inside your body? Your bone. Yeah, that's it. The bone. The bone. The bone. Let's see, I already picked on Elena. Chi-Chi. Next one. What quadrant contains the appendix? The right lower quadrant. You got it. And that's the abdominal quadrant. So anything in the abdominal quadrant is going to be below the diaphragm, right? Because the diaphragm separates the thoracic from the abdominal. Jeremy, I'm going to pick on you next. Are you ready? Should I pick on you or Sully? Sully? All right, Sully, you got volunteered. All right, Sully, read the next one. I'm not looking at it. Okay. On the right lateral surface. Okay, so below the lower back, posterior to the lower back, superior to the thigh, on the posterior lateral surface. What would that be? You said glute. I said the right butt cheek. Right butt cheek. That's what I was trying to get you guys to say when I was coming up with this at 9 o'clock at night. I was like, how can I describe the right butt cheek? And so I said, let's see, inferior to the lower back, superior to this. We're going to say those terms in this class. We're going to say all the terms. We're going to say penis, we're going to say breast, and we're going to get used to saying them a lot because it's kind of funny to say them now, but when you have a patient that has cancer there, you need to be able to say it. So that's why we're going to say all the terms. We're going to get very comfortable using them in language, because when you're talking to your patient and you're describing a situation, you need to be able to say those words, because this is anatomy. This is at this point, these terms are anatomical. It's science. It's not personal. It's not, you know, it's science. It's medical at this point. Okay, so it kind of helps switch you over. Are we done with that? Is that all of them? 2 more. Ooh, who should I pick on, Eric? Who do you think? You go then. Read the next one. Inferior, medial. Okay, so inferior means below the shoulder. Medial means toward the midline. So what would that be? Yeah, so it's in the thoracic area. So it could either be the sternum if you go all the way to the midline, or it could be the breast, right? Male or female, breast. What would the region be called for the breast? Mammary, mammary. What would it be called for the sternum? Sternal. Good. Okay. And Catherine, read the last one for us. And what do you think? Superior and inferior. Perfect. The transverse plane cuts it into a superior and inferior. And we can't say top and bottom, because what if the patient is laying prone on an operating table? Then the top and the bottom are different. What if the patient's in a wheelchair? What if you're assessing the patient standing up? What if they're like, what if you're out in doing survival training? I have a student that got trained for first aid out in the wilderness. It's called Wilderness First Aid. It is the coolest training. But what if you have a patient that was rock climbing and fell? Then they're not going to be, they might be in all sorts of different directions. So you need to get used to using these anatomical terms. Yes. Upper body and lower body would work. Yeah, sure. Upper limbs, lower limbs, head and neck. It would be, you could also say for that one, you could say beheading. That would work. Decapitation. Decapitate them with a transverse plane, a transverse cut. Don't actually do that. So I want you and your partner to work on these worksheets to practice. I want you to work on what's on my region, the drag and drop. Will prepare you for your quiz on Friday. Your quiz on Friday is everything we've covered this week. Directions, planes, cavities, and regions. The drag and drop is practice on OneNote. Do the worksheets first, because the worksheets, if you don't finish them today, they're homework. And then we will go over them first thing tomorrow. I don't think I'm taking them for a grade. They're a grade for on level, but not for AP. So if you're watching the video and you're on level, it is a grade. AP, not a grade. And everyone watching this video is going, ah, man. All right. Yeah, you should have taken AP. Yeah, but you guys kind of have like a million other things. And a book you have to read, and a comp book you have to do. At least it's only one book. I only make you read one book.